COVID has left hospitals across the state overwhelmed, many on the verge of collapse. There's a hospital in El Centro that's getting hope from a federal medical disaster team armed with a drug originally developed to treat Ebola. Kitty Alvarado has details on what they're calling a wonder drug.
The National Disaster Medical System deploys their disaster medical teams to help communities in times of crisis.
We often respond to disasters across the country under a federal declaration.
They sent a team of 9 medical professionals to El Centro Regional Medical Center, not to help the overwhelmed hospital staff in the ICU, but to prevent more COVID patients from being admitted.
We are operating an infusion center with the monoclonal antibodies.
We first heard of the experimental cocktail infusion when it was given to President Trump. Since then, the FDA authorized it under its emergency use to treat COVID-19. The founding scientist of Regeneron says the lab made proteins fight off the virus.
The highest risk patients, we showed that within a week, we could drop viral levels 100-fold. And that's what you're trying to do. You're trying to wipe out and get rid of the virus.
To get the treatment, you must be within the first 10 days of symptoms, show proof of a positive test, and be in what's considered a high-risk category. This nurse says most who receive the antibody cocktail say it works.
And you can see it right through their masks, but they'll tell you the majority of the people that walk out of our tent are smiling. Others have come back. They feel 100%. They feel great.
The team in El Centro was using one made by Regeneron and another by Eli Lilly. I asked the leader of this infusion team if it's a miracle cure.
I believe it is as close to one as I have seen yet.
She says they have to wait and see the data. But until there is a cure,
we're showing what can be done and giving people hope, and that's huge.
Kitty Alvarado, NBC Palm Springs.
Eisenhower Health is also administering the treatment, and it's still only